For our next session, we're going to turn to Mari Savickas, who is VP of Public Policy for Chime, to walk us through a cybersecurity policy update from Washington. Mari and her team are all of our go-to resource for all things Washington health IT policy, HHS, Congress, the administration, and they're undoubtedly going to be helping us navigate through what promises to be a very exciting upcoming year. Mari, tossing it to you.
Thanks, Lisa. Good afternoon, everyone. Welcome to the debrief from Washington, broadcasting from 23 degrees. It's pretty cold here. Lisa's going to help me run the slides. So, Lisa, let's just move on to the next slide, please.
Okay.
As I was putting together the content for these slides, obviously I straddled two administrations and had to make several changes as of this morning. So it does sometimes feel like you're holding this crystal ball and trying to prognosticate about what's going to happen. So these are, to the best of our ability, our prognostications for at least for like the next few weeks. So I can see everything. So maybe let's just move to the next slide. And I know Lisa's managing my slides for me, so we're just going to roll with it and I'll keep talking. Yep, we're going to cover the federal update, congressional, and then a little bit of how to get involved as a member. And we can head to the next slide. Let's talk about the executive order extravaganza. Those are my words. Last night, well, actually, it started yesterday, shortly after President Trump was signed in again. 78 executive orders were signed yesterday, and there's more coming. The media has been widely reported that there could be as many as 200, but last night was a flurry of activity. Checking the website this morning, and yes, you'll get slides for everything. There's hot links here. 45 as of this morning were posted to the website. So I want to highlight two in particular that are fairly noteworthy. There's a lot that are noteworthy, but just as far as like what's in our swim lane, is one is the DOGE one, and then one is the regulatory freeze. So let's move on to slide 5. And I just want to just highlight before I get into the meat and potatoes is I grabbed this screenshot from one of the articles, and you can see, a little bit of data in terms of like how many were signed in previous administrations, including Trump's first term. And you can see that there really weren't a ton. There were more with President Biden, but last night made broken records, so a lot and a lot more to come. So be prepared for that, and we'll cover a lot of these in our Washington debrief, which goes out every Monday. If we move on to slide 6, I want to unpack the government efficiency, Department of Government Efficiency, which has been in the news quite a bit. And while it is not yet, it's not codified, meaning it's not in statute as a real cabinet level position. So what they did was they took an existing area of the White House and they renamed it. So that gives them a little bit of shelter. So it's the digital service, which I think most Americans probably don't know what the digital service is. Just as a little bit of background, it was created under President Obama, and it essentially was created during the onboarding of the new Obamacare benefits. And the website had so much trouble that they called in tech experts from Silicon Valley and the West Coast to come in and try to fix it. And so this area, this arm of the White House is used for really tough technical issues. And so what they did was they renamed the digital service to be the Department of Government Efficiency. So this is probably step 1. There's probably more coming. It's going to be led by Elon Musk, which is still continuing. Vivek Ramaswamy is no longer going to be involved. He's heading back to Ohio to run for the governorship. So that's where it stands right now. If you look at the if you look at the executive order, you'll see a section 4. It's focused on, it says software modernization, but I think that that's just the beginning. And this is a pretty wide term that they've given him wide berth here to go forward. So I think more details will emerge, but every federal agency is going to have to appoint at least 4 people to work on their agenda, which they indicate will go up. There's an 18th-month agenda, and that DOGE will sunset in July of 2026. So clearly, we're going to get a lot more information in the coming days but I just wanted you all to like know exactly where that stands as of today. The other thing I wanted to highlight too is that there's congressional caucuses who have been forming around this government efficiency effort, and they are moving full steam ahead. I put in a hot link to an article here. The Senate Republicans prepare blitzkrieg on Biden era regulations. So they've already formed like 8 working groups. They're targeting government waste in a variety of different areas. A few of them, just to name a few, are like Homeland Security, defense, veterans, energy, supplemental funding, a whole host of different issues. So I think you're going to see several bills come out of these efforts. So just be on the lookout for these as well. And I think we can move on to the next slide. So covering the second executive order that I wanted to talk about is a regulatory freeze. And this one will be of high interest, given that we are all looking at the HIPAA proposed security rule. So again, just unpacking this, details are fresh and we still have some questions, but here is what it says in a nutshell. It prohibits government agencies from sending any more rules to the White House. OMB is the Office of Management and Budget. It's another arm of the White House. It's the one in charge of issuing regulations. It says, don't send us anything new. Don't do it. Everything's going to be frozen for right now. And it says anything that was sent to the Federal Register, which is really the last stop, like where it gets published. If it's not published yet, it's not going out the door. And these are fairly typical steps that new administrations take. So this isn't like unique to President Trump. This regulatory freeze calls for, and this is the part I want to highlight in red, for considering postponing for 60 days. The word like considering is important because right now, if you check the HHS website, you'll see that there's hardly anyone in charge of any agency. They haven't named anyone yet. And so they need to figure out what to do with this rule, whether it will continue to move forward or whether it will be clawed back. And I think it has a decent chance of being clawed back, but that goes back to the crystal ball. We're at Chime, we're treating this very seriously. We've reviewed it very carefully. We'll get into that in a moment. But right now, this is just what the regulatory freeze executive order says. And then it says, too, it's not just like final rules. It could provide proposed rules, guidance documents. So as these agencies start to be populated with Trump appointees, then more decisions will be forthcoming in the next few weeks. So I think we can move on to slide 8. So clearly we're still in a period of transition, and this with transition brings uncertainty. With uncertainty brings stress and anxiety for hospitals and others in the healthcare sector. Totally understand that. It will start to take shape, but it's going to take a few weeks, right? So a lot of things happened in the last few weeks of the Biden administration. They threw what I would call like all the spaghetti against the wall. They issued several things like a cyber executive order, which if you get our debrief, it's going to be unpacked. The cyber Biden executive order will be unpacked in our debrief today. So look for that. It's a special one focused on cybersecurity. And then we also have some fact sheets on HIPAA, the security rule, which again, calling into question what's going to happen. There was also a hospital cyber proposed mandate rule. That's not the official title. I'm just giving it to you because the official name doesn't say anything about cyber. But parked inside of it was going to be cyber. And this one, again, Politico reported last week it was coming. Guess what? It didn't come. And per the regulatory freeze, it's now definitely not coming. So that's still rattling. That was still rattling around out there. And it was going to include mandates, again, allegedly, that we confirmed with CMS, hospital mandates around cybersecurity borne out in the form of Medicare conditions of participation. So something that most hospitals are adamantly opposed to. And we're opposed to them as well. It's very heavy-handed. Let's talk about CERCIA for a moment. So CERCIA, again, was a proposed rule. That one was out there, and it's not scheduled for final publication, at least, again, like this is as of the Biden administration until the fall, this coming fall. So this could be completely clawed back and reshaped, reissued. More details, we'll be looking for that, of course, as CISA leadership takes shape. And that's takes me to my last point here. Not all agencies have a Trump named official in place. CISA doesn't. They have to be confirmed by the Senate if it's a political appointee, right? Most of them take Senate confirmation. Right now, the Senate has not confirmed a secretary for HHS, right? They're just starting the confirmation process. So for temporary for all intents and purposes, governments are being run by career civil servant government agencies. So right now, HHS is being run by an endocrinologist, and who's a career civil servant, and so is CMS. So more again as the weeks, in the coming weeks, there'll be more who are named to agencies. I think we can move on to slide 9. So let's go back to the HIPAA proposed rule. Like I said, we're taking this seriously. We plan on commenting. We have extensive analyses for you. I don't have the hot link here, but Carol's going to put it in. I got the hot link after I sent the slide deck over, but we have a summary of the HIPAA proposed rule. So Carol can stick that in the chat. It's very long. And then below that, there's right here is the second sub bullet here. It says crosswalk. That's the crosswalk of HHS's cybersecurity performance goals, crosswalk to the HIPAA security proposed rule. Okay, so you can see, I'll just give you the highlights. The 10 essentials and 10 enhanced are included in the rule. It wasn't like some table was plopped in there and like, here, we just dumped them in all 20. It wasn't like that. They are interspersed throughout the entire rule. So we plan on having work group calls. If you're interested in having a work group, being part of our work group and you're a member or foundation firm, you can contact us, and my contact information is at the end of the slide deck. The other thing too, Carol, if you want to throw into the chat is I have another document for folks that is from our consultant Thorn Run, and Thorn Run, and we can send them out too with the slides also. I'll make sure that they're included in the slides. I see people can't copy or click. Okay, so no worries here. I'll update the slides, Carol, and I'll make sure, again, everything was changing so quickly, I couldn't get everything hot linked, but we have a great document that talks about all the executive orders in case you're really super curious about executive orders. So long story short, HIPAA security rule completely in question. We do not know until such time that OCR decides, should they decide to claw this back, we're moving full steam ahead. We're commenting on it. I would just say this about it. We've done enough of a round robin, and I know that Nick Kuchar, he's one of our members and he advises us on cyber policies on. This is a heavy-handed rule, and we know that most members will struggle mightily to meet it, even the better resourced ones. So we have a lot of things to say about this. So welcome everyone's comments.
Questions from the audience.
Let's see.
So the NPRM that was already submitted and is in the comment period, it can still be pulled back? Question?
Yes, it can. So again, so let's just go back. I know it's a lot to take in. So the regulatory freeze announced yesterday by President Trump says that agencies have discretion to claw these kinds of rules back. They have discretion, meaning they may or may not, right? And so we don't know yet. There's no one really in charge of OCR. So we have to wait and see. But until such time as it does get clawed back, should it get clawed back, we plan on commenting by the deadline of March 7th.
Okay, thank you, Mari.
Okay. So let me just see what else I missed here. Oh, so just some of the key provisions of the HIPAA proposed rule. There's a lot in here. So let me just go through a few. So under the rule, which again is in question, but right now, as it stands, the OCR has proposed, and this is all proposed, everyone, proposed, it's not final. They've said we're going to get rid of addressable requirements, addressable standards, and make everything a required standard. So they think that too many covered entities are treating this as optional. So the nicest possible way. The rule adds dozens of new implementation specifications. It also says, it talks a lot about the MD Anderson case, which OCR partly lost because the court felt that OCR's guidance wasn't clear enough. And OCR reacted to that by saying, not only do you have to have guidance, it's not enough to, or not only do you have to have a policy that says that you are doing something, you actually have to have a policy showing how you're executing on it. So you actually have to do it, is basically what they said. So that's another big point in here. That's mentioned several times, and many of the proposed standards cover that. Notably, there's no carve out for rural or small healthcare providers in terms of what's being required here. They just believe like this is so seismically important, you all have to do it. Another thing they are calling for is a mandatory asset inventory and a network map of all your systems. which would need to be updated at least every 12 months or more often if there was a cyber incident. Mandates two-factor authentication. I would look at that piece in particular in the rule. And again, it's in our that, and I'd say the encryption decryption pieces. If you were to look at nothing else, I would look at MFA and encryption decryption. Those are really important pieces. It talks about how all PHI has to be encrypted with some exceptions. Backups can't be older than 48 hours. Staff access has to be removed within 1 hour of termination, and then restoration of critical systems within 72 hours. To quote one member, if we all had the money tree, then these would be ideal requirements, but this is a lot when you take the totality of the rule. So that's the HIPAA proposed rule, and we'll move on to slide number 10. And again, just briefly on the Biden cyber executive order, I'm not going to talk too much about this. I'm just going to point you, it's covered here on the in like the little breakout box here, but I would just take a look at our debrief coming out today, which has a lot more details on this. And this is also in question as far as will be clawed back. And I don't think in the past few hours it's been clawed back. It could have been. So we'll have to check on that again. But as of this morning, it was not yet revoked. Though notably, you'll see in here like a mention of like the last bullet promoting adoption of post-quantum technologies. The AI executive order was clawed back. So President Trump did revoke President Biden's very extensive and lengthy AI order, which has some cyber pieces in it. So just take a look at this. But again, this is not yet. So the Biden cyber executive order is still standing as of 3:46 today, but be on the lookout. And we'll be updated. That document from Thorn Run will get updated, and we will be updating everything in our Monday debrief. So that's that. Moving on to slide 11. So here's another tool that the president and Congress have at their disposal in terms of how they want to treat rules that they maybe don't agree with, is the Congressional Review Act. This one you may have heard of, the CRA. So essentially, it's a way that Congress can overturn certain federal agency regulations and actions. And if they're issued within 60 legislative business days, then they have like this look back period. There's also another look back period that goes back to about August 1st. This is very complex stuff when you really get into the meat and potatoes, but in the shortest possible way to describe it is another tool to pull back rules. And it hasn't been used a ton, 20 rules in total. So there have been 200 attempts to use it, but only, I guess, 20 were successful. But there could be more. So that's something also to pay attention to. And if anyone has any questions, they can either reach out to me or, again, we have a hotline here for you. So moving on to slide 12. Cyber donations, all the mysteries of things that people may or may not have known about in Washington. Under Trump 1.0, he passed under his administration, there are 2 rules. So did you know that you can actually receive, if you're a provider, receive donations on cybersecurity? No cost, unlike with EHRs, they had to have about 15% skin in the game. This is no investment is needed. There are parameters and bumpers around it, but you actually are allowed, providers are allowed to receive them, and there's no restrictions on who can donate the technology. So many people don't know about this. It's totally underutilized. I think there's a variety of reasons why it's underutilized, not just because some people don't know about it, but also I think there's a fear that if you donate technology and then the donee experiences a cyber incident, that maybe there'll be some sort of if downstream blowback if they're, if like they could be blamed for it. But here's the thing is you can track. So this is something we're going to draw more attention to. So look for a cheat sheet coming soon. So again, this is final. This is on the books. You can do it today. No, you can't give money per se, but you can give certain hardware and software. And so we're going to outline this in a cheat sheet. But this was put forward by CMS and OIG under the first Trump administration. So go forth and conquer. And then also looking for feedback on if you've looked at this and you haven't used it, would love to hear more why. So that is cyber donation. So we can move on to slide 13. Talking a little bit more, moving to the congressional side. So the very powerful Senate Help Committee, just you may all, again, some of you may be on top of this. The new chair is Senator Bill Cassidy. He's a very powerful member of Congress. He's a physician. He's been supportive of cybersecurity. He's the co-sponsor of the Healthcare Cybersecurity and Resiliency Act of 2024. So let's move to slide 14 and we can unpack this for a moment. There's been two big cyber bills rattling around Congress as of late. And again, every bill is going to have to be reintroduced because it's a new Congress. So this is under the last Congress. So this is the one Cassidy was a co-sponsor of, and it contains many good things. Is it perfect? No, but it is far more agreeable than the Senate Finance bill. And I see I've got 10 minutes, so I will get through all this. So in a nutshell, when we say grants, it's not a ton of money, but here's the thing, is it's a step in the right direction, as opposed to the Senate Finance bill, which I'll talk about in a moment, which is very penalty driven. This one's more carrots, the other one's more sticks. Calls for standards, like that would be like CPGs, guidance for rurals to help them, guidance on, so Public Law 116-321, it doesn't really roll off the tongue, but this is the one you may recall that was one of the last bills signed into law by President Trump during his first administration. It gave credit for use of best practices. So this says, hey, let's get some guidance on this, because OCR never issued guidance. Calls for incident response plan, clarification of federal duties, really, assist to HHS, and then some workforce pieces. So we have all the links in here. Let me move to the next slide here, which is the Biden Warner bill. So this is the Senate Finance driven bill, otherwise known as HITSA. This is the more punitive one. And again, we've gone through both of these with a fine tooth comb. There's a lot in here that is hard to unpack. And before you get too excited about $800 million upfront payments, when you really break it down to how many providers there are in hospitals, it's a very small sum of money, and there are very heavy penalties. The second to last bullet, to your DRGs and to your market basket. So 2 fees there, plus there could be fees for user fee fines, and there's corporate responsibility. There's they remove caps on HHS fines. There's a lot of things in here that are really what we would consider sticks rather than carrots. And so there's a lot less to be desired, but this one may be reintroduced. And so we'll be watching for this one as well and advocating for more agreeable approach. So we can move on to slide 16. So the continuing resolution, we can't talk about anything in terms of Congress without talking about the CR. So you may recall that the government was funded until December 21st. They had hours to spare. They were able to pull the bunny out of the hat. Now we're looking at March 14th. That's the next drop dead date. And if you're lost, you're like, wait, what's the CR? This basically is a way when Congress can't agree on how to fund a government for a full year, they just basically continue the funding from the previous year. So we're still in FY24 funding, even though we're in FY25. And so the lawmakers right now are trying to agree on a move forward strategy, which is still super tricky. President Trump is meeting with the GOP leadership today. They're going to try to hammer out more details. This is still really, really tough because Trump wants this one big fell swoop, ginormous bill. And the lawmakers are saying, I think we should do this maybe more like a two-step approach. So they're even strategy. They're trying to figure out strategy, funding levels. There's a lot of things that they want to cover. They want to cover tax cuts. They want to cover immigration, things that have nothing to do with cybersecurity. They want to make cuts. There's a lot in here. I also just say this about funding is that we'll be looking very closely at how lawmakers fund agencies that we care deeply about, like CISA, NIST, OCR, and FDA, just to name a few in terms of cyber. So that is all happening. Literally, the earth is moving underneath us as we talk about this. So we can move to slide 17. Again, the budget reconciliation. This is just a way to sidestep the filibuster by using a tool called budget reconciliation, where you can get a majority of the vote, simple majority versus say 60. So you can see that is also a big part of these discussions. Moving on to slide 18. I wanted to highlight and strongly urge everyone, please, please, please take our survey. You're like, oh, please, not another survey. I totally get it. But this will help us be your voice in Washington. We're looking for your ideas about where we can remove burdens. And the door is open on this. So please complete this so we can send both President Trump and lawmakers our best ideas. Slide 19. So what does the future hold? Basically, the first 100 days of any administration are extremely pivotal. So they're going to set policy and direction. Big focus in this administration will be on deregulation and federal savings. Trump and Congress are focused on how to address the debt ceiling, which is another big piece of this. There's going to be a lot of things that are outside of our swim lane. Like we're not, we don't deal with immigration. We don't deal with energy. There will be legal challenges. They've already started to the executive orders. Trump needs to get all of his nominees confirmed, which will be a process, and that takes a lot of energy by Congress to focus on that stuff. There's a lot of questions about which rules will be pulled back, which we just discussed. And my final parting thought is like, before you count your chickens, like, oh, the OCR rule will definitely be clawed back. I just like to say, don't count our chickens before they hatch. We're still treating this, as if it's out there and we have to comment. So that's our strategy. Moving on to our next slide. This is how you find us. It's not just me. We have a team here. Chelsea Cassie and I are the public policy team. We like to say we're small but mighty. Sign up for our debrief. Everything that we have is open source, no firewall. Okay, you can get all of our stuff. You can sign up for our debrief. Again, cyber focused one today. And last but not least, you can find us at Vive. We'll be presenting on, of course, all things cyber. So that's it. And I don't know if I got questions or not, but it looks like people want links. Yes. Carol, I'm going to send you an updated deck with links.
And there were a couple of questions about how to subscribe to digital download and to policy updates from Chime.
Yep. So right here, policy at Chime Central, you'll hit the whole team. We're small. We pay attention to that box. So everyone, policy at chimecentral.org. Yes, it will be emailed Mark. It will be emailed by Carol right after I update the latest and greatest links. Please reach out to us. We'd like to talk to people. We like to know your thoughts, even if you want to agree to disagree.
Thank you so much, Mari. That was a jam-packed presentation. You got through a lot, and there's a lot more to come. So everyone stay tuned, and please reach out to the public policy team if you need anything. Thanks, Mari.